Welcome, and happy Good Friday, everybody. Thank you for joining us today for this webinar. We always start them about 5 minutes early, and as you can see, the panelists are already up there. You know, everyone's social distancing, which is good. We always start these about 5 minutes early, just to make sure that everyone's audio and visual and everything is working. I will say this now, and I'll repeat it again at the end because it's probably the one thing you actually do need to know, which is if you have questions or problems as the webinar is going on, there's a question box down there at the bottom. Go ahead and ask your questions down there. If questions for the presenters, questions for me, questions about audio visual, and we will do the best we can to answer them. Before I do my opening spiel, I will say that in the last couple of weeks, in general across America, the internet has been pretty strained, everyone working from home. We've had a couple of people say that audio has gone out on them. I am going to ask if it goes out, if it's been working and it goes out, just hold on. It usually comes back within 30 seconds to 40 seconds. That's generally been the thing that happens. So if that happens to you, unless it's happening right now and you don't hear me, just hold on. It's probably going to return because I get that a lot. A question, the audio just went out, and then 30 seconds later, never mind. So my name is Michael Fortin. I'm the Director of Advocacy here at Legal Services. We're really excited to be here and present this to you today. If you don't know, Legal Services is the statewide free legal services for the poor in the state of Alabama. We get a lot of funding from the federal government, but also from many grants, including grants here in Alabama. We don't currently get any funding from the state. Every time we start these things, we basically ask people, we started these trainings a couple of years ago really as an opportunity for people to learn about the topics that we know a lot about. We brought in a lot of outside speakers. But we always really want to encourage people to volunteer two ways. Most of you are attorneys, not all of you, but most of the people attending are attorneys. If you have not signed up to volunteer with the volunteer lawyer programs, there are 5 volunteer lawyer programs in the state of Alabama, the 4 big cities, and then the Alabama State Bar covers the rest of the state. If you are able and willing to volunteer to give your time, you can go to the State Bar website. There's a form you can fill out, and you'll get contacted by the appropriate volunteer lawyer service. And yeah, obviously, the need is there now more than ever. There is now a second way to volunteer if you're interested, which is that the Alabama Law Foundation is overseeing the Alabama Legal Answers, which Legal Answers is a program made by the ABA, the American Bar Association, which basically low-income people can go on the internet, ask a question, and then it'll be given to a lawyer, basically, who then answers it at their leisure and gets the person an answer. It's a really easy way to volunteer, as opposed to, as you know, traditional pro bono would be going to court and really helping someone change their life. But if you can't do that, Free Legal Answers is a great way to help someone at least get the information they need to make the decisions for their life. So it's convenient, and it also helps us to cure, and I don't know that FAR is going to go into this today, but Alabama has a not unique problem, but it certainly is a long-standing problem that a lot of our lawyers are centered in the big cities, and so a lot of our pro bono is centered in the big cities, and a lot of people out in rural areas need help too. And so if you're able to do Free Legal Answers, that's great. We are coming up. We're going to start in about 2 minutes. I'll just repeat again. If you're just joining us, welcome. Happy Good Friday. If you have questions as the training's going on, there's a little box down there. You just type the question in there, and I will either give it to the presenter or answer it if it's an audio-visual question. Really, you can, you know, anything that you need, that's the way to do it. For some reason, people send me emails during the webinar. I will not check my email till after it's over, and that's not very helpful. Second thing, the handout. If you want a copy of today's presentation, it's in the menu over there on the side. You can go ahead and download it right now. inevitably somebody will still ask me, and if you contact me afterwards, I will certainly still send you a copy of it by email. But just know that for this presentation and all our presentations, the materials are over there on the menu, so you can download them immediately. And the last thing I will say before I hand over, it's 12, so we're coming up on a start time. The last thing I'll tell everybody, since I get this question every time, if you are a lawyer and you are interested in getting CLE credit for attending, as long as you registered and put your bar number in and you did the full registration, you put your real name in. I don't know why some people put in a fake name or a fake email address, but as long as you registered and did everything you were supposed to, nothing else for you to do. You do have to stay through the whole presentation. The computer will know who attends. It's a unique, everyone got their own unique sign-in. But other than that, you just stay on the line. We will run the report, send it to the bar, nothing else for you to do. So there's your credit will appear in a couple of weeks. And I don't know how the bar is processing these right now. It may take slightly longer than normal, but certainly it'll be there within a month or so. Other than that, if you have any questions, again, use it the bar on the side. But with that being said, I think it is about time to get started, and I'm going to go ahead and let y'all go and let the presenters take over. Thanks so much.
All right, thank you, Michael. We wanted to talk today about the safety net programs that are here in Alabama. The safety net programs are important for people facing a hard time, and with the COVID-19 pandemic, there are a lot of folks who are facing hard times financially right now. So I'm going to talk a little bit about unemployment and food benefits, and then Jim Carnes with Alabama Arise will talk about healthcare access and options. And to wrap things up, Flora with our office is going to talk about the federal stimulus and consumer issues that are coming up. So first, unemployment compensation. We're going to arrange a speaker, or we're in the process of arranging a speaker from the Alabama Department of Labor to go into further detail, because there are a lot of changes in unemployment. And we're hoping to have that next Friday. But we didn't want to miss the opportunity to highlight an important resource for Alabamians facing job loss or loss in hours or income during this time. So there's been two updates to the unemployment system. The first was back in March. The Alabama Department of Labor loosened up regulations. And I put a link to a press release that the Alabama Department of Labor put out that kind of outlines the regulations. But basically, back in March, workers were able to file a claim if they were quarantined by a medical professional or government agency, laid off or sent home because of COVID-19, had COVID-19 themselves, or were caring for a family member with COVID-19. And the thing that especially was loosened up back in March was that you didn't have to show that you were able and available to work. Typically with unemployment, you have to say that you're able to work. But for instance, if you had COVID-19 or were taking care of someone, you aren't going to be able to go out and search for a job. And so back in March, those regulations loosened up. But it didn't address the issue of independent contractors, gig workers, and other folks. And so the CARES Act has further expanded unemployment benefits. And I put a link to a press release from yesterday from the Department of Labor that includes a good summary, and they put out a really informative chart. You can go on there and look, that gives details. But basically, the CARES Act expands who's available or who's eligible for unemployment. So those independent contractors, the church daycare workers, someone who might have been scheduled to start a job but hadn't actually had any time in the job when the pandemic happened, those types of workers are going to be able to apply for unemployment. The CARES Act also expands the benefit available. It adds a $600 benefit on top of what you would be eligible for in Alabama. So before the pandemic, the weekly benefit in Alabama was between $45 and $275 a week. And the CARES Act adds an additional $600 a week on top of that. And the CARES Act also expands the amount of time someone could be receiving unemployment. It puts additional weeks on to the unemployment time frame that you're eligible for unemployment. So we'll, again, we'll have more information on unemployment, but we really want to encourage people to apply. Workers can file online at the website on this slide, or they can call. There's been a good amount of folks who are having trouble applying, and that's just because of the expansion in the amount of people who are trying to apply. The Department of Labor has ramped up their workforce, and they're really trying to meet the need. But back in February, unemployment in Alabama was at a low. And so when this pandemic happened, there was really been a whole lot of people who are needing unemployment compensation benefits. I would give a caveat. We would encourage most every worker who's eligible to apply for unemployment. But the one caveat is if your employer is applying for unemployment on your behalf and you apply, that's going to make a delay in the process. So we would encourage workers to check with their employers to see if the employer is filing on their behalf. And if so, to let the employer do that because it'll speed up the process. And so the information is there on that slide. And Farah, you can go to the next slide. We wanted to talk some about SNAP, and that stands for the Supplemental Nutrition Assistance Program. We've had a large increase in calls over the last 2 weeks to our program from people who are facing food insecurity and having trouble purchasing food. SNAP's important in all times. Before the pandemic, 15% of Alabamians were receiving SNAP benefits, and about 3/4 of those on SNAP were families with children. So SNAP has always been an important resource for folks to make sure that they meet their nutritional needs. But right now we are seeing folks who have not had food insecurity before facing food insecurity issues. So we wanted to talk about some of the changes that have happened with SNAP due to the coronavirus. And there's been one of the changes on here. I put a link to a news article just to show the amount of increase in SNAP benefits between February and March. Or you can go to the next slide.
We did have one question back to unemployment that someone had asked. Is weekly reporting still required?
So they're asked to go in and do weekly reporting, still do that. But you know, you're not expected to be going out to work as long as you're able to go back to the job that you had once it opens back up again. So still do that weekly reporting on the computer system or call in, however you do that. So with SNAP, what's new right now, the first thing is the increase in volume. So typically, you know, DHR might get 400 cases in a week of new applications. And I think we heard numbers of 20,000 in about a week and a half of new applications. So DHR, like the Department of Labor, is still working to meet the needs of Alabamians. But it's just an unprecedented time where there's many more people applying than typically do. But as far as substantive changes, there is a waiver to allow DHR to provide the maximum benefit for March and April. And there's also a waiver of the work requirements. So what's a waiver? Basically, Alabama's DHR program is based on law and regulations, and DHR has to submit their plan to the USDA and get it approved. And then if DHR wants to loosen the rule or change the rule, they have to get a waiver from the USDA. So when we say waiver, that's DHR asking for a change in the rule. And you can go to the next slide. So the first waiver that the state has gotten is permission to increase the maximum food benefit or to increase the food benefit to the max for all households. So the maximum food amount is on this slide here. You can see it varies based on your household. But before COVID-19, you wouldn't necessarily get the maximum amount. It depends on how much your income is available to spend on food. So for example, last week I had a client, the household was the size of 3. It was a single mom and 2 children. And before the coronavirus pandemic, she was working and she received about $100 a month in food stamp benefits. When everything started coming on, she ended up losing her job, and she was trying to call DHR to let them know that she lost her job and just her benefits increased. Fortunately, because DHR increased the maximum amount for everybody in the month of March, even though she wasn't able to call and get through on the phone, her benefit increased to $509. So that was a blanket waiver for all households in Alabama for March and April to go up to the maximum amount. We don't know if they're going to continue that on. It depends on how things are, how things go. But right now, the waivers for March and April. And you can go, well, I don't have a slide for this, but the other change is a waiver in the work requirements. So before COVID-19, any adult between the ages of 18 and 50 had to be working a certain amount of hours to qualify for SNAP benefits, as long as they weren't taking care of a dependent child or disabled or a dependent adult. With the Families First Act, all states are able to suspend the work requirement. So that's important for folks who may have been kicked off food stamps in the past because of work issues, or folks currently who aren't able to work because of the pandemic. That shouldn't be a barrier to food stamps. And so we can go to the next slide.
We have another question about unemployment. Someone asked, people who are already getting, well, and again, you said next week we're hoping to have an unemployment webinar with someone from Department of Labor. But are people who were getting unemployment before this started, did their unemployment get extended as well?
I would assume yes, but I have not looked into that issue in particular. I would assume it would apply because right now you're not going to be able to find it. It might be harder to find a job. But I would stay tuned for the Department of Labor presenter next week.
But they don't get the extra $600.
I don't know.
I can tell you, I've looked at that. They don't get the extra $600.
Okay. So as far as things that have not changed with SNAP yet, but could, the Families First Act has provided guidance to the states to say certain rules that they would approve loosening of. And if you're interested, there is a website that the USDA has put together. The Families First Act requires all of this waiver information to be made public. And it's really interesting to go and look to see, what different states are doing and what Alabama has done. But the Families First Act gives permission to the states to allow a loosening of certain administrative burdens to help the state agencies meet the need for folks applying for food stamps. And one of the possibilities would be folks could get a waiver to extend their certification period. Right now, many households in Alabama have to recertify their SNAP benefits every 6 to 12 months. And they're, like in normal times, March, April, May, there's people who are having to recertify. And with the increase in people applying, the state, for example, could extend the certification period. The state has different options to look at making the application process a little bit more streamlined. And I understand DHR is looking at doing that and trying to figure out how they're going to make those changes. So we're staying tuned for that. And there is a second benefit that the Families First Act has given to the states to provide additional SNAP benefits related to school lunches. Right now, a lot of school systems are doing grab and go pickup lunches. I've heard of a lot of school systems, the one that we're in Henry County, are suspending or pausing those grab and go pickups because of health concerns. The Families First Act would allow SNAP to provide an additional benefit to families whose kids are not in school and maybe were on free or reduced price lunches to add an additional benefit. I understand the state is working with DHR and the Department of Education to see if that's possible. So far, only one state, Michigan, has done this. And Jim?
Rochelle, I just got a text from my colleague, Carol Gundlach, saying that Alabama has submitted its plan to the USDA for increasing SNAP benefits for families whose children are eligible for free and reduced lunch.
Okay,
So,
good deal, good deal.
earlier than expected.
Okay. Yeah, so as of yesterday, Michigan was the only one with an approved plan, but I'm glad to hear that Alabama has submitted that, because I think from what I understand, the USDA is trying to approve these quickly as they come in. You can go to the next slide. So who is eligible? So far that the basic eligibility guidelines have not changed. It's based on your income and resources. For resources, DHR is looking at your liquid resources. They're not counting your car or your house, but like what kind of assets you have on hand. For an individual, it's $2,500 or less. For an individual who's elderly or disabled, it's $3,500 or less. And you can go to the next slide. The income amounts are based on your the federal poverty guidelines. For households without an elderly or disabled individual, they're looking at your gross income being 130,000, not 130,000, I'm sorry, 130% of the federal poverty guidelines or less. And so that middle column in the chart is what 130% of the federal poverty guideline is for a month's income based on your household size. For families who are elderly or disabled, you only have to meet the net income limits. And although those are smaller, that takes into consideration the expenses that you have for shelter and utility and those kind of expenses. So it's a more lenient standard often. You can go to the next slide. For additional resources to apply for SNAP benefits, you can go online to the DHR website. They also have a paper application that you can print out online and mail in. They are open, but they're trying to do things by phone or online. And if you have questions about your eligibility, there's a Fresh EBT website, and there's 2 links on there that you can go to look to see if you would qualify. The application process does take some time. You can get expedited application if your income is less than $150 a month, and that's supposed to be 7 days. The typical application process time is 30 days. If you need immediate assistance, the United Way of Alabama, you can call 211 and find if there's resources in your area. And to find or support a local food bank or pantry, you can go to the Alabama Food Bank Association website. And I know the food banks are really struggling too right now to meet, to keep up with need and to provide resources. And you can go to the next slide. This is more of a footnote, but I did want to mention the WIC program. I think over 50% of infants in America benefits, and it's 185% of the federal poverty level. So it's more people could qualify, but it's for infants and children under the age of 5 and pregnant or women who are recently postpartum. But if you want more information on that, WIC also has expanded their or streamlined their process to allow them to process things remotely and over the phone. And their information's on this slide. And next we'll move to Jim to talk about health care.
Thank you, Rochelle, and thank you, Legal Services Alabama, for inviting me today. COVID-19 is placing extreme pressure on Alabama's healthcare system and our health insurance system. So I want to take a look with you this morning on resources available on 3 tracks. I'm going to touch on COVID-related care, then move to health coverage for uninsured Alabamians, and then lastly, general health care and concerns that might be useful at this time. So let's start with testing. Free testing is available, but not all testing is free. So the testing landscape, as you all know, is changing from day to day. Testing sites are popping up, and some are closing down, and hours are changing. So I meant to put the state COVID-19 hotline phone number on this portion of the slide, but obviously I omitted it. So if you've got a pen handy, I will just give you that hotline number. That is 1-888-264-2256. That is a 24/7 hotline that has up-to-date information on testing sites. So what happens if an uninsured person contracts COVID-19? You may have heard that CMS, the federal agency that oversees Medicaid and Medicare, has determined that they can use some of the newly appropriated federal dollars to reimburse hospitals for COVID care delivered to uninsured patients. The problem is, I mean, that's great, but the problem is there hasn't yet been detailed information about what will happen for people who present with COVID, who are diagnosed with COVID, have to go into the hospital, but also bring along their whole picture of healthcare issues, and how will the hospital sort out what it can treat for free, and how to document other health problems. It's just there are a lot of questions that have yet to be answered about how that so-called free COVID care in the hospital is going to work out. But the important thing is that's a starting point, and we're hopeful that the clarification will allow hospitals to cover what are called comorbidities, that is coexisting health conditions that are not strictly COVID related. As we know, COVID really preys on people who have underlying and pre-existing health conditions. So it's highly likely that anyone presenting with COVID is going to have other things that need treatment as well. So we're awaiting further guidance on that. I have written these slides mostly in the second person, thinking that they can be sort of public facing, and you might be able to use them if you're giving advice to a client who calls in or seeks your assistance. So let's move to the coverage landscape, which starts with Medicaid here. That's the main health coverage option for people of low income in Alabama. As you probably know, Alabama has not opted to accept the federal Medicaid expansion, which would allow us to cover all low income adults up to 138% of the federal poverty level. As a consequence, we are stuck with the eligibility limits that have been in effect in Alabama for a long time. And I apologize for the tiny print on this slide. I hope maybe you can enlarge it. I'm operating on a borrowed computer that has somewhat limited my access to my images and things, but I will help you understand the important parts of this graph here. Because we have not expanded Medicaid, we have varying income limits depending on the patient profile, you might say. At the top of the scale here, we have our most generous programs, which cover former foster youth. There is no income limit for former foster youth up to age 26. For children, Alabama has been pretty generous. Our Medicaid coverage, the dark green there, is not really so generous in national comparison, but with our very generous All Kids program, or the Children's Health Insurance Program that kind of sits on top of Medicaid to cover higher income families, our children's coverage is very, very strong and ranks very, very highly across the state comparisons. Then there are a few special groups. There's a breast and cervical cancer patient group and people in nursing homes. But then when you get down to sort of the middle of the chart here, you'll see that we cover pregnant women up to 146% of the federal poverty level, and we provide family planning services up to that same level. But below that, the bottom three tiers are the ones that really cause a lot of concern. For people who are categorized by Medicaid as aged, blind, or disabled, those are not terms that we generally use nowadays, but those are Medicaid eligibility terms. So you can see that there is sort of coverage well below 100% of the poverty level for that group. But then this is the surprise for many people. In Alabama, in order to get Medicaid coverage as an adult who does not have a disability, as you see, we cover people with disabilities at slightly higher levels. But if an adult does not have a disability, in order to get Medicaid, you have to, number one, have a dependent child in the home. And number two, you can't make more than 18% of the federal poverty level. 18. It's an absurd limit. We're the second lowest in the country after Texas, but that is where we stand because we have not expanded Medicaid. Furthermore, if you're an adult under age 65 without a disability in Alabama and have no children or no dependent children, you simply can't get Medicaid coverage. The new dynamic that COVID has introduced is that many people in Alabama who have had no need to understand these eligibility limits are suddenly finding themselves without health coverage because they have lost their jobs and lost the coverage that goes with that. For some people, that will mean that they can become eligible for Medicaid because Medicaid eligibility is based on current income. The problem is many of those people, as we've just heard Rochelle explained, will be eligible for unemployment benefits and even special unemployment benefits during COVID. So that income will count against them and in many cases will rule them out of Medicaid coverage. So just bear in mind that you may have clients who have lost coverage and then the question becomes, do they qualify for unemployment benefits? If so, they likely will not be eligible for Medicaid, but it's still worth applying. If they don't qualify for unemployment benefits, there's a good chance that they can qualify for Medicaid. Even so, thinking beyond the adults coverage, many people who are becoming newly employed in this crisis will lose their health coverage. Their own health coverage will depend on this unemployment, whether they qualify for unemployment or not, but their children may well qualify for Medicaid coverage. So if the family's unemployment benefits fall below 146% of the federal poverty level, then the children in that family can qualify for Medicaid. And if those benefits fall below 317% of the federal poverty level, then the children in that family would qualify for the All Kids coverage. Coverage under All Kids has a small premium there's a bit of a sliding. It's kind of a toggle. There's a low premium and a high premium, but they're both very modest. So be advised that many of your clients will have children who can get enrolled in Medicaid or all kids, and even for the adults, there's a possibility of that. So let's move forward into some specific details about Medicaid. I'm sorry. Back, if you could go back to the previous slide. I was focusing on the chart, but I forgot to go back to the text there. There's a really good new rule in place for Alabama to qualify for the new federal funding that's available for emergency services during COVID. Those came with a maintenance of effort requirement, which means that we have to leave the Medicaid program intact. We can enhance it, but we can't cut it in any way during the emergency period, or we'll lose those federal funds. So that means that everybody who is enrolled in Alabama Medicaid for any reason, for any service or any eligibility program or whatever, who was enrolled in March, gets to keep that coverage through the entire emergency period. That means that if a family's income happens to go up beyond their eligibility, or ordinarily that would have kicked them off Medicaid, but they can keep that coverage during the emergency. In particular, the one group I want to focus on is women who have just delivered their babies. Alabama Medicaid covers 2 months of postpartum. That means that for 60 days beyond delivery, the Alabama women who qualify for pregnancy coverage can keep their coverage, and then they lose it at that 60-day point. During the emergency, anybody who was already on pregnancy or postpartum coverage in March gets to keep it until the end of the emergency. So we expect that to go probably beyond 2 months. So that means that these women will be able to continue their Medicaid coverage for longer than they would have otherwise, which is good news. If we had expanded Medicaid, that wouldn't even matter. They would just have coverage. But because we have not, that benefit is of particular importance to them, that extension. Now let's go to the Medicaid continued slide. Just a couple of notes here. People who are benefiting from that extension, who are maintaining their coverage, need to continue as usual in documenting any income changes, reporting that to Medicaid, reporting anything that affects their normal eligibility, and also to go through the process of renewing their coverage at the appropriate time, just so that will be in place when the emergency ends and they'll have a smooth transition. A couple of other important things to remember is that copays have been suspended for Medicaid during the emergency. So currently, no one has to pay copays at the hospital or any other point of care. And if any of your clients have questions about their Medicaid coverage or need to report a change, here's the number to call, and then there's an online portal for making those changes as well. So we can go to the next slide. This broadens our scope to look at people who are newly uninsured and want to find out what they can qualify for. There's a simple sort of one door process for that. The online application at Insure Alabama on the Public Health Department website will walk the client through the process of determining whether they and their kids are eligible for Medicaid, whether their kids may be eligible for all kids or the Children's Health Insurance Program, or whether they qualify for discounted, I call it discounted coverage on the health insurance marketplace. You may have heard some of the controversy about CMS's resistance to declaring a general open enrollment period, special open enrollment period for the emergency. That is something that we're continuing to call for. They haven't yet done it, as far as I can tell. Things change so fast that I want to issue a disclaimer here. If something has changed since I last checked, I welcome you to find that updated information. But as of the last time I looked, they had not declared a general special open enrollment period. However, it's always been the rule on the marketplace under the Affordable Care Act that people who experience certain life events, they're called, they're major changes such as the birth of a child, the death of a family member, move to another place, the loss of insurance. Now, loss of insurance is the key. If a person's job loss has caused them to lose their insurance, then they can go to the marketplace and find out what they're eligible for, and they will likely be eligible to sign up for a highly discounted, maybe even fully discounted premium on the marketplace. However, job loss, separate from insurance loss, job loss does not constitute one of those life events. It's kind of weird, but so people whose income has changed will have to it's just sort of on a case-by-case basis. They'll have to go and find out, but this number here for assistance in figuring that out, Enroll Alabama, and I happen to be wearing my Enroll Alabama t-shirt today, Enroll Alabama is providing telephone assistance for folks who need help walking through that determination process. Okay, we can go to the next slide. An important resource for people who are without health coverage but need to get medical care it would be the network of community health centers across Alabama. As we say here, there's a widespread coverage across the state, up to more than 160 locations, satellite centers connected to the 17 main community health centers, providing a variety of services. I've listed some of the standard services available at all of the centers, and these are available to folks regardless of insurance status on a sliding fee scale. So obviously people who are without coverage and are experiencing income loss or are out of a job would obviously have a very generous sliding scale for those costs. And some of those services are free. All of the centers are providing COVID-19 testing in one form or another. At some, it's walk-in clinic testing. At others, it's drive-through testing. But the best way to find out what the availabilities are and what the hours of service are in your local area is to call first. So when you're thinking about sending a client to the network of community health centers, the first thing for them to do, or perhaps you have someone who can assist them in doing this, is to go to the website at Find My Health Center and use the geography to determine which center they need to check in with. Then using that contact information, you can have them call to find out the updated hours. As you all know, because of staffing concerns and local travel policies and all that, these things are shifting day to day. So call the number of the local center and find out what their current hours are and how you can best avail yourself of their services. Sometimes that involves scheduling an appointment. Sometimes it's just walk in and take a number, that kind of thing. So just call and find out. So then we can go to the last slide. I wanted to take this opportunity. This is not squarely within the realm of healthcare, but it is, it certainly does encompass healthcare. And I wanted to point out some resources for two groups that are of particular concern during this crisis because they are more likely to be of high risk for COVID on the front end, and then they're also more likely to face barriers of access and information. So anything you can do to help push out information in these two communities would be very helpful. The first is, and they're both, both of these resources deal with both of these special communities. So people who are living with disabilities and people who are living with mental illness. The top arrow there points to a general resource guide that Disability Rights and Resources in Birmingham has put together, and it's a growing, source of information. So that's a very good place to turn for people who are seeking information and contacts on a variety of social service issues, particularly geared to people with disabilities and mental illness. And then the second arrow points to legal assistance specifically tailored to people with disabilities who are facing either special COVID-related concerns or other concerns about exercising their rights as people with disabilities seeking housing, food assistance, any of these social services. If there's a legal component to the barriers people are facing in terms of eviction or whatever, and the client or a client family member has a disability, then the Alabama Disabilities Advocacy Program is the place to go. And here is a phone number and a web intake form for ADAP. So I will stop there and pass it back to Farah. Thank you.
You had one question, Jim. The
Yeah.
question was, I think it said that you're eligible as a life change if you lose your insurance. And somebody asked, is that true even if you're eligible for COBRA?
COBRA, if you're eligible for COBRA, you would likely not be eligible for Medicaid as a parent. But it is well worth calling the enrollment number, calling the insurance element number, because COBRA is temporary. And to be honest, I don't know how COBRA coverage intersects with marketplace coverage. So that is something that you can get a very, very answer to.
Okay, well, and Jim, I don't know what happened there. You suddenly turned into like a terrible monster voice. Yeah. I muted you for a second. I'm gonna unmute you, but I think it's not. Farah, how's your sound?
Does it
Thank
sound
God.
okay?
Yeah.
Okay.
Still bad.
Uh-oh, yeah, Jim's is still,
Yeah.
don't know.
Okay. Sorry.
Just okay. So I just wanted to spend just a few minutes talking about the federal stimulus payments. There's been a lot of information in the media about this, as some of this you may know, and then just some questions that we've run into that people have about the stimulus payments, as well as some related consumer issues that we anticipate cropping up as people start to receive the stimulus payments. So just as a quick refresher, in case anyone
is not aware, the stimulus payment, it's $1,200 per adult, and then an additional $500 for each child 16 and under. There's an act pending in the legislature to increase that to all dependents, but for right now, it's just people that are 16 and under. One thing that I personally wanted to make sure that I knew and wasn't sure about is that the money is actually, it's basically, it'll show up as a credit on the person's 2020 tax return that they'll file next year. So it's basically a loan from the government. They do have to pay that money back. So that's something that I've seen some confusion about, but that is the current status of it. And the payments are available to people that are earning up to $75,000 a year. Of course, that or it's $75,000 for an individual or $150,000 for a married couple. And if you're making less than $99,000 a year, you still receive a payment, but it's reduced. It's basically reduced, let's see if I can remember this right, $5 for every $100 that you are above the $75,000. So if you're making between $75,000 and $99,000, you still get a payment, but it's going to be less than $1,200. And so the payments will be sent. It's based on wherever you filed either your 2019 or your 2018 taxes. So if there was a bank account that the IRS had, the money should be direct deposited into that account. If you received a refund through a check in the mail, then they should still have that address and they could send the money there. One issue that a lot of folks are having is what to do if their address has changed, or if they, filed with a spouse that they're no longer married to. There should be a web portal that will be available for people to go in and update their address if it's changed, or if any of their information has changed from the last time they filed taxes. That is not available yet, as far as we know. But yeah.
I know we've been doing this for 4 weeks now. We keep saying that things are going to change. Like, this is as of 11 o'clock. There's an email from like 11:30. The IRS portal is up and functioning. At least people who don't have addresses online with them already can go put it in the portal now.
Okay, great. Well, that is really good news. And of course, that happens when we're about to do a webinar. But yeah, that's great news. So there is apparently an IRS portal that is available now where people can go and log in and change their information if they need to update their address or any other information about where they want that check to be sent. So people that are on Social Security and disability and certain other benefits like veterans benefits, they are still eligible to receive a payment. If it's someone that worked but didn't make enough money to have to file taxes, they're still eligible. People that have no income or people that are on SSI, as well as retirees, all of those individuals should be eligible for the payment. So the question then is whether or not you should file a tax return. And again, this is something that's sort of changing. Once they start sending out the checks, it may be too late, but if you think you're eligible for a payment and didn't file taxes in 2019 or 2018, it's still a good idea to go ahead and file now, because there's no harm in doing that, and you may get paid faster. Right now, it looks like people will get paid a lot faster if they use the direct deposit as opposed to a paper check. So I still think it's a good idea to go ahead and file. If you think you're eligible for a payment and didn't file, it still makes sense to go ahead and file now. And the related question to that is, what about people that are on something like Social Security that don't normally have to file taxes? So if someone's on some type of benefit and they have dependents, then they probably should go ahead and file, because otherwise the IRS isn't going to know that they have those dependents. So that's important, and that's again probably the quickest and easiest way for them to actually get the money is to go ahead and file a tax return. SSDI and SS Social Security retirement benefits, they should be able to, they don't have to file their taxes. They should be able to get the money on however they normally get paid. But other types of recipients like SSI and VA, they may need to file a return. And if people need to file taxes, there's a couple of free services out there. The IRS actually has one if you're making up to $66,000 a year. And then My Free Taxes is another website that's available if you're making up to $69,000. So for folks that need a free tax filing software, they can use one of those. And the stimulus does not count as income for benefits like SNAP benefits and SSI and things like that. So that's good news for folks that are on those benefits and that have a resource limit usually. All right, then of course the next big question is, when will the checks arrive? So as far as where we are still hearing that they may, the direct deposits may start as early as next week. So that's obviously great news for folks that need that money. Just some news reports that we saw yesterday showed that the paper checks are going to take a lot longer. And we've heard that those people may not get them until September. But an article that Rochelle shared with me yesterday, I think it was from Forbes, basically said that the payments, the paper checks that are mailed out, it may be based on people's income. So people that are making, say, less than $10,000 a year are going to get their checks first, and then that's going to go up as people's income increases. Now, that's not from an official government source yet, so we don't completely know if that's true. But anyways, there's at least some reporting that the paper checks that are mailed out will be based on income. So even though those will take a lot longer, they're going to go to the people with the lowest income first that, presumably need the money the most. So that's some good news. All right. And so the other good news is that if you owe debts to the government, so whether that's student loans, tax debts, some type of overpayment from an agency, they're not going to take that money out of this payment. The one exception to that is for child support. So if people owe back child support, then they may see their stimulus payment taken for that. And I only have a few minutes and I talk really fast normally, so I'm going to try to get through the meat of this just as quickly as I can and not, go too quickly. But there is no automatic protection for the money. So for example, like Social Security cannot be garnished by other types of creditors. So you're talking about non-government creditors like credit card companies, people like that. There is no automatic protection right now for the stimulus payments. So a lot of folks may not realize that if they're getting these checks, there may be creditors standing in line that have judgments against those people already that are wanting to take that money. However, that money is probably going to be exempt under one of two ways. So the first way is, so EITC funds, which are a tax credit that's available to people that make low income and have children, those are exempt in Alabama under In re James, which is an 11th Circuit case. It's a bankruptcy case that got appealed up to the 11th Circuit, but the case interprets an Alabama statute that says that any sort of public assistance cannot be garnished. And in re James, the 11th Circuit interprets that language very broadly to say that because the basic purpose of EITC is to provide relief for low-income families, it should also be considered public assistance, and therefore it's exempt from any kind of garnishment. The same analysis can basically be applied to the stimulus payments. The basic premise, the reason the government is giving out this money, which is relatively unprecedented, is to help people that are out of work right now during this time of, this crazy time and this global pandemic that we're going through. So there is an argument, I believe there's a good faith argument to be made that the payments could be considered public assistance, just like EITC, which is exempt, not just in the 11th Circuit, there's other states too, but here it is certainly considered exempt. The second way that these payments may be considered exempt is just under Alabama statute. So ALA Code 6106 is the statute that contains what we basically refer to as the wild card personal property exemption. So what that means is people can use that statute to protect any personal property that they have, whether that's a vehicle, money in the bank, whatever. And so that amount currently, and I'm not going to go into the details of why that's the exact amount, but those are the two sites there. It's $77.50 in Alabama right now. Most people, a married couple with 2 children, are going to be getting much less than $7,000 as a refund. So the personal property exemption, which again is just the wild card exemption in Alabama that covers any kind of personal property someone has, it should cover the stimulus as well, because most people are going to be getting less than $7,000. As far as the mechanics of how to do that, so if a judgment debtor receives a bank account garnishment, they can file a claim of exemption in the court. The creditor, of course, has an opportunity to contest that if they think that that's invalid. They can file a sworn contest stating why they think that. But if the debtor prevails, then of course they're going to get the money back. So that money should be considered exempt, either as public assistance, just like EITC, or just under the general wildcard personal property exemption in Alabama. And one last thing that I'll bring up that I just kind of wanted to mention as we're talking about garnishments right now. So most courthouses in Alabama are closed to the public right now. A few of them, many of them, I think, have drop boxes and things like that. But of course, creditors can still file garnishments. Certainly, if they have attorneys, they can e-file those. So we do have a concern with people that may be receiving garnishments that may be served on their employers for those people that are still working. And it's, you know, it's really a due process issue for those people to be able to assert their exemption rights if they can't get to the courthouse, or if during a public health crisis it's not safe for them to get to the courthouse. So I don't have necessarily a solution to this other than certainly tell people to call us. We are, and by us I mean Legal Services Alabama, we are all still working remotely. We're still able to file emergency pleadings and things like that for people. If anyone if anyone is facing this. And of course, we always love when private attorneys take on these cases and help us out, since, you know, there's only a few of us. So that was everything really super quickly, and it looks like we have 4 minutes left if anyone has any questions, but all of our information is here as well. And I think we would all welcome any sort of questions even after today from anyone.
Okay, well, we do have some questions. How's your sound, Jim? Is it back?
You tell me.
I think it's better. Okay. So someone asked, is testing available for someone with no symptoms who needs a test to be admitted to a nursing home, has Medicare, and will be on Medicaid within a nursing home, otherwise indigent? Family will pay for a test if necessary. Is there a test available?
Well, in general, yes, but it sort of depends on locality. So the best thing to do, I mean, the state has an array of free sites that the Department of Public Health is running. In addition, there are other sites offering free testing, but that's a very fluid situation. So the best thing to do is call the 888 number and check for your precise location.
Okay. All of the other questions are about the stimulus. I think one of them is easy. Would a college student that may have never filed taxes but is not a dependent be eligible for the stimulus payments?
If they're not a dependent, then yes, I think so.
As long as I think they have to be 18.
Mike, you might know more than I do about that.
I think they have to be 18, but as long as they're
right.
16 and 17-year-olds apparently fall into a black hole. Although there was introduced last Saturday an All Dependents Count Act in Congress. Not sure if that's going to go anywhere, which would cover all those dependents, but certainly if you're not a dependent. Is it true DHR is intercepting stimulus checks for child support?
I don't know if they are, but we have heard that there may be an exception for people if they have, I guess, arrears that are owed. So I don't know if they actually are doing that, but they may be able to, is what I've been told or have heard.
Let's see. What if tax returns were filed in 2018 and 19, but neither time did they get a refund? And I don't think there's ever been a specific guidance, but I'm thinking if you gave them a bank account to withdraw the money from, they will put it back there. And if you don't, then they're going to send it to whatever address you provided with your tax filing. I mean, they're using
I think that's right, because I think even if someone maybe owed taxes and had to make a payment and used a bank account, I think that the money could still go into that bank account. So I think even if they didn't get a refund, they should be able to. It should go to whatever information the IRS has for them.
We have a question, and I think this might fall into a different employee at call center with no insurance. Employee is sick and has taken tests, but it takes 3 to 5 days for results. The employer will not allow them to miss work. That may very well fit, and I'm actually fairly sure, unless the employer has more than 500 employees. If they do, it might not be covered. But the Families First Act will let companies where there are less than 500 employees get automatic family paid full pay leave for up to 2 weeks, even if they're just showing symptoms. And if you don't, we had a training on that 2 weeks ago. It's still available on our YouTube site. And if the employer refuses to give that leave, not only is that extremely irresponsible because you're possibly spreading the virus, but also, you know, there's penalties, there's law, I think there's attorney's fees and stuff. But there's a webinar out there on Families First, so you want to take a look at that. And any guidance, last question, any guidance on how a couple with a child born in 2020 should report the new dependent or for the stimulus money? Any?
I guess they would just have, the only thing I can say is they'd have to go into that web portal and update their information if they've already filed their taxes for 2019. And they have a new dependent since then. I guess they would have to go into that web portal. But the answer is, I don't think we know the answer to that yet, other than that.
Well, and this is apparently this is going to appear on your 2021 taxes for 2020. So I assume if you don't claim them now, you may get paid in the future. Like you may be entitled to that. One person did say, does stimulus need to be paid back next year? The answer to that is no. We know that because Congress discussed whether or not, if you get paid too much because, you know, perhaps you got more income in 2000 or less income in 2018 and you're over the 75 or the 150K in 19, apparently there was debate and at least agreement in Congress for what that's worth, that if you got paid more than you were supposed to, you wouldn't have to pay that back either. You know, we all know what the discussion on the Congress floor is worth in terms of law, but that is, it's at least an indication they're not going to collect back the payments, the stimulus money. With that being said, we are 2 minutes over, and so I want to thank our esteemed panelists. People are asking when they can watch this again. This will be available on our YouTube website probably sometime tomorrow. It takes a minute for the computer to process it. Hopefully y'all got the handouts. If you haven't, you can email me and I'll send them to you. Thank you, Rochelle. Thank you, Far, and thank you, Jim, so much. I'll have a great weekend.
Thanks.
Bye.